Good afternoon or good evening, everyone, according to your place and your time zone. I'm very happy to be with all of you today as the introduction session for our course, preparatory course for Part 2 MRCOG, which is designed to make all of you ready for the exam in January 2023. I don't know, but it's my pleasure and happiness and honor to be with all of you today. My name is Mohamed Hassan. I am an instructor for Part 2 MRCOG, a mid-exam expert since 7 years and more. And I am examiner in the Royal College of Obstetricians and Gynecologists, London, and accredited trainer as well. So today, joining me in this session, my dear colleague and the shining star, Dr. Pradnya. Hi, Dr. Pradnya, how are you?
Hello, sir. Hi, how are you? I'm doing really well, and I hope you're all doing well too. Thank you so much for being with us on this platform. We are beyond excited to have you all with us, and we're all hoping that you all make the best of this course and come out with flying colors.
Yes, this is our aim and our target, and what we are thinking in med exam experts that we believe in success, and this is our simple, because all of you are deserve success. The hardworking as well as the smart working, both of them together will be the road to success in this exam. I know very well that MRCOG Part 2 is the most difficult step in this certificate, in this prestigious certificate as well. So, but we are trying to do our best to simplify the situation as much as we can. So what I'm looking for always is, oh, I think she is the youngest candidate for MRCOG ever. I'm all right. I think she started the preparation very early in her life.
A little too early.
Exactly. So this is normally how we are joking, because as I said, she seemed to be the youngest candidate ever in our course. So I'm very proud of that we attracted her attention. Yeah, no, please don't wish for her to be a gynecologist or obstetrician. It's a very hard job and very difficult life. So let her be a painter or a singer or something very gentle, rather than spending her life in blood pools and stressful conditions. Believe me. So
I agree, sir.
yeah, this is what I am thinking for my daughter and my son, Pradnya, actually. I will never let them being doctors one day.
I wonder why my father let me be a gynecologist in spite of being a gynecologist himself.
Yes. So yeah, what we will talk about today actually is to clarify certain points regarding the preparation, because I know many candidates are really anxious regarding the preparatory way. How can we prepare? What should we do? And what we are waiting from the course? And how can we collaborate together to reach our target? So simply, yes, yeah, after welcoming everyone, I suppose that the agenda of our session today, regardless how to apply for the exam, because most of you will know very well the new techniques, we will answer the frequently asked questions by all candidates, and then prepare showing the preparation of the MRCOG Part 2, and then just a very small hint about the course, what the course will provide, what your expectations from this course, and how can we finalize our work. So just a second, please. Can you make me the presenter, please? Okay, I will go on my side. Yes. Yes. Okay. So simply how to prepare and how to apply for the course. I know that all of you know the technical points regarding the presentation, how to apply, but the point is how to prepare. Now, it's really important to go for a smart studying rather than hard working job. Now, I need to explain this before giving the mic to Dr. Pradnya. I am here to say that there is a big difference, my friends, between the knowledge and how to utilize this knowledge. There is a big difference between how much you know and how can you apply what you know. This exam is to know how can you utilize your knowledge. So what I would like to say is, it doesn't matter how knowledgeable you are. The most important relevant thing is your knowledge matching with the most hot topics required by the college. Can you use your knowledge in the proper way to answer the questions properly? This is how can we deal with the exam, and this is our job as mentors to focus on the exam point of view regarding the knowledge, because I'm always saying that MRCOG curriculum is like an ocean. If you are get inside the ocean without compass, without leader of the ship, of the boat, you will be lost simply. And this is exactly the same example. You can start working and studying from textbooks, evidence-based medicine book, guidelines everywhere, scientific impact papers daily, TOG articles 4 times in the year with about 6 to 7 articles, new articles in each edition. So how can you cover everything? You are not a machine. And this is not required, by the way. It's very important to select what you need to know and to do a dedicated, focused, smart studying for 3 to 4 months before the exam. That's why I can reassure all of you, you will be more than ready before the exam date. I think, or I hope that all of you got it, got my point. So how can I do this? How can I smartly study and prepare myself? This is what we will do right now. Dr. Pradnya, can you take this part of the discussion for me, please?
Yes, of course. Thank you so much, sir. Thank you so much, sir, for such an insightful thing that, yes, it is a very vast curriculum, but RCOG has a way of asking questions, and with a little bit of direction and with a lot of hard work from your side, this exam can be cracked. Well, let's just touch upon the topic or the curriculum that's going to be covered during your sessions, and which is going to be asked in your exam. Now, there are 14 modules. Beginning from the first module, there's clinical skills. In the course, we will be telling you what topics are to be read from where, and if you have some difficulty, we will be there to provide those particular guidelines for you on your Telegram groups as well. The second module is the teaching, appraisal, and the assessment module. The third module is information technology, clinical governance, and research. I think these are a few topics which are a little difficult for overseas candidates, and we will try to break it down and make it simple for you in the session itself. Now there's core surgical skills and post-operative care. So RCOG has a very good, nice article and TOG articles regarding it, which will be covered during your session. Surgical procedures, the antenatal care, maternal medicine. So next slide, please. Management of labor and management of delivery. These would be covered as well. In postpartum module, the gynecological problems, subfertility, sexual and reproductive health. Early pregnancy care is another small module, which is comparatively very easy and something that could help you score really well. Then there is gynecological oncology and urogynecology, which is Hassan sir's favorite topics, and he's a master of those topics. Well, now coming to the format of the exam. Well, in the exam, there are going to be 2 papers, all right? And both the papers will have single best answer questions, and they will be having extended match questions or EMQs. Well, in terms of single best answer questions, there would be a question, and there would be 4 to 5 options in the either in the order of frequency or alphabetical order, some order or the other, in which you have to choose one answer which is the best according to that particular question. It might not be the best in some other given scenario, but in that particular scenario, in that particular question, you have to choose the best answer. Now coming to extended match question. Extended match question is not something that you faced in your part 1 exam. It is quite different. There are going to be a lot of options which are going to be given in the beginning. There are going to be options from A till I and PQR, and there are going to be many options. And there will be a set of questions. In the sense, there will be 3 to 4 questions which would have these similar options. The trick to solving these questions is not to sit and read all the options. First, read the beginning statement which is given. Understand what they are asking for. For example, if they're asking for the best management of the best investigation or the first investigation, and then jump straight to the first question that is given. Once you read the question, you try to formulate the answer in your mind, and then you start going through the options. So this way you will be able to evaluate, you will be able to exclude the answers which are most probably wrong and be able to pick up the right answer.
I like this way so much. I used to say, Dr. Pradnya, that this is the exclusion method to answer questions. I am used to be trying to all of the time mastering the exclusion method in my practice. I am not trying to answer the absolutely. I'm trying to exclude options. Then the true answer most probably will appear spontaneously without effort. You catch my point? I mean, instead of reading everything and options in details and trying to find the answer, let the answer appear to the surface spontaneously by excluding the other options. This is very easy and very effective way to answer the questions. It's really a mastering part in EMQs, but sometimes in single best answer, my friends, because the name is single best answer, it means that there are other good answers. Okay, so sometimes you may find out of 5 options, 2 or maybe 3 options acceptable. So you need to go for the single best one option only. This is maybe difficult somehow. And in EMQs, most probably the exclusion way will be ideal. However, I believe that single best answers are more difficult than EMQs. I'm against most of people. I think that single best answer really sometimes may be confusing because you may stuck in 2 options and you have to choose one of them. So we will learn together how can we minimize our chances of mistakes by doing exclusion method and choosing, even if you don't know the question topic, you can minimize the risks on scientific basis. I will show you how to do that, but later on. Please continue, Pradnya. Thank you.
Thank you, sir. So why sir is saying single best answer questions are easy is because he's so thorough with all the guidelines, and what the EMQs are basically testing is how to go to the next step. They're basically checking your the flow charts that you have in your guidelines. They're basically checking that, the algorithm of what to do, what would be the next step after each. All right. Okay. So we can move on to the next slide, I guess. Right. So the source, basically, these are all the sources from which you're supposed to study. There are green top guidelines. There are NICE guidelines. There are TOG articles. In terms of the importance of each, I think the most significant would be the green top guideline. Then comes the NICE guideline, and then the TOG articles. The TOG articles that we most commonly want to focus on are the ones that do not have any specific green top guideline or NICE guideline for it. For example, heart disease, or anticoagulation, perioperative anticoagulation, or something like that. So the TOG articles, we do have a list of the important ones and the second important ones and the least important ones. We will be sharing that with you in the course, in due course of time. Well, these are some of the most important NICE guidelines that are there, which you have to be absolutely thorough with. There is no chance that you cannot know these, like the diabetes, hypertension, infertility. Yes, why sir has underlined it and circled it is because there is nothing else for infertility. There are TOG articles, but you have to be absolutely thorough with the infertility NICE guidelines, the urinary incontinence, new NICE guidelines, which came out when we were giving exams. The intrapartum care is absolutely important, so as to be able to solve not SBS, but EMQs. They're going to ask you, what is the mode of management? They will give you a scenario and ask you about the next step, for which you have to be absolutely thorough to convert your NICE guidelines into a flowchart or into a story as such, to be able to pick up what to do next.
Yes, Pradnya, actually, I mentioned these 4 guidelines from the NICE because of sometimes candidates are really confused where we need to study this topic from. Sometimes the conflict is really obvious, like in infertility, like what you said. We have a lot of TOG articles which are more recent and updated than the infertility NICE guideline 156 2013. But unfortunately, we have to follow the NICE guideline, this edition, even if we have TOG articles more recent and new editions, because the NICE guidelines are highest body of evidence than the TOG article. So if we have any conflicts, we have to go first for the GTG and then NICE guidelines, and after that the TOG articles. The urinary incontinence and the intrapartum care, preterm labor, and menopause NICE guidelines as well, they are extremely important sources. For example, if we take this one, the LARC guidelines, okay, the long-acting reversible contraceptions. NICE talks about this, but the Faculty of Sexual and Reproductive Health, which is mainly concerned about family planning methods, guidelines, they are superior than the NICE in this point. So most probably no need to read this one in your curriculum. You got my point, my friends. For example, the mental health guideline. We will summarize the most important things for you, and no need to read the rest of the guideline because it's huge. This is our job, to redirect you in a proper way and to select the most important things, targeting the exam point of view, not the knowledge point of view. What I would like to say is, again, there is a big difference between both, because I think it's really stressful to read the guideline for exam purposes, but it will be really funny to read the guideline for your own knowledge after being MRCOG or finishing your degree and lying in front of the beach and reading the updates for your knowledge. There is a big difference between both. I'm right, friends. I think, yes, now we are not looking for the knowledge too much. We are not looking for the exam point of view. After that, after finishing the exam and pass the exam and being MRCOG member, now you can read whatever you want for your own knowledge. This is acceptable, by the way. However, we can show you another, the third one, the TOG articles, which Dr. Pradnya talked about. In the last 3 years, it's most importantly to cover the important things we will mention. But overall, you may find, sometimes you may find old TOG article, but there is no other source for this topic rather than this TOG article. So it will be necessarily important to read it. For example, let me give you, for example, hyperprolactinemia. This guideline, hyperprolactinemia, this TOG article is 2012.
Yes.
It was published by a very famous Egyptian, by the way, Egyptian chief consultant IVF in UK, Yaqub Khalaf. There is no other sources for hyperprolactinemia for your exam. So you have to read it, despite it's 10 years previously. I mean, old, 10 years old TOG article, not in the last 3 years. You got my point. For example, uterine perforation, Diab 2013. There is no other option. So I have to read it carefully. That's why we try to summarize the never missed TOG articles in your preparation in this slide. Okay, this is very important. TOG articles. Okay. Now, moreover, the PASH guidelines and the NHS cervical screening program, they are extremely important because the PASH guidelines is mainly concerned about the infections, different kinds of infections. And the college itself, following the PASH guidelines in managing different kinds of infections, as well as the sepsis in some situations. So we will select the important topics related to us in this condition from the PASH and deliver them towards all of you in a very simple, summarized, targeted way, as well as in the NHS screening program, which is unfortunately regularly updated by the NHS. So we need to follow the last edition of it. The Faculty of Sexual and Reproductive Health guidelines. They are mainly concerned about the family planning method. So we will follow the guidelines of them for your exam. However, I would like to reassure you that we just need to follow a very superficial basic information related to the family planning, because actually the FSRH guidelines, I mean faculty, it's a separated faculty and separated diploma exam. So no need to go in depth, just we need to take the basic information and the most important safety points regarding the patient. Others, like Dr. Pradnya mentioned before, they are limited, very limited and small topics like scientific impact papers, clinical governance and consent guidelines, and they will be explained in between our sessions smoothly. And finally, the Embrace UK reports, which is concerned about the maternal and neonatal mortalities in UK. It's updated every 2 years, so you will be delivered by the latest information regarding this. Dr. Pradnya, are you still here?
Yes.
Yeah, let's move for the next one. Books. I will let you decide the best books for candidates, please.
I personally like really old books, you know, the ones like Kalewani and Tahir Mahmood and Brian McGovern, and all these books might be old and their keys might be, you know, not wrong. They might be old keys which were according to the old guidelines, but these books had really good pool of questions. A few new ones are really good, like Justin Conhay. So I think all the books that are there on your screen right now from Andrew Sizer, which is a good book to start with. It's an easy book. It is to get into the groove of Amanda Jones is an easy book to get into the groove of solving questions. It's really good. Then a few difficult ones. Yeah, Janesh Gupta is also a good book, but Tahir Mahmood and Kalawani and all good quality books which should be done after at least the first reading of all your guidelines. Towards the end of when you Andrea Pilkington as well. But yeah, Seema Sharma is a very good book in terms of the quality of questions.
I mentioned Seema Sharma particularly, Pradnya, because it's, categorized book. I mean, the questions are in each module separately. They are not mixed questions. Yes. So this is maybe helpful for the candidates if you finish the early pregnancy module in the session, so you can go for the early pregnancy questions in Seema Sharma. I mean, they are very well organized according to modules. So somehow it may be easy as beginners for the question books. Okay, this will be ideal.
Right, I agree. But I believe that it's very difficult to actually, except for Seema Sharma, all of the books have questions which are pretty haywire. So it's very difficult to sit and search for one each module. So I would suggest you keep solving questions. Even if you get something wrong, mark it so you can come back later and then revise it. But don't waste your time searching for questions of each module in the whole book, in which you can actually sit and study and do some more productive work. And if you find something wrong, keep it marked. When you come back for revision, go through it. The ones that you get right, forget about it, because you will anyway get those questions right in your exam as well. So keep revising the ones, decrease the number of questions that you have to revise towards the end. Solve all the books at least 1, 2 to 3 times, and I think you're all good to go. And then strategy questions. I think they're the most important question pool. A lot of times they ask questions directly from strategy. That makes it very important. And there is no chance of keys being wrong in strategy. Whatever strategy says has to be correct. There's no wrong key and right key in that. Shehzadi, we will be, I hope you're a part of the course. We will be sharing the books on your Telegram group, if that's okay.
Yes, I think this is very important and necessary, by the way. Yes, I will repeat them again. I will give you the names, and we will send the PDF version of these books. Yes, all these books on the Telegram group, by the way. Now, regarding the strategy, regarding the strategy. So most probably, strategy is a very important source, not only for questions. It's also providing some important, very small tutorials about certain topics. They are summarized in a very well fashioned summarization, and they are really helpful. So what I suggest, you can go and have an access to strategy site by subscribe to the site itself. It's somehow about 110 sterling pounds for a year. So sometimes I suggest that people can do some groups together and they can share the same account. I know this is against the the ethical point, but this is how it's work. Okay, and maybe 2 or 3 person can do a small group and sharing the same account, and everyone can have the access for 2 days, for example, per week. Okay, so it will be really beneficial for all of you. How can they we cannot exactly like Sir Hassan. How are you, Sir Hassan? How are you? Can you open your mic? Or you are still busy? I don't know.
Assalamu alaikum, everyone. Good evening.
Dr. Hassan, sir, is the CEO of the mid-exam. I'm very happy to hear your voice here again, sir. How are you?
Good evening,
Thank
sir.
you so much, everyone.
Great to have you on the session.
Thanks a lot. I would like to welcome all of our course candidates in the very first session of MRCOG Part 2. I will not disturb the conversation. So please go ahead, Dr. Hassan and Dr. Pradnya.
Thank you for your participation, sir. Thank you so much. Thank you. And as Sir Hassan said exactly, it's a copyright preservation, so you cannot take any thing from the site or even to download anything. It's illegal and protected by the RCOG copyright. So what we can do, as I said, we can do a small groups, and you have to go with strategy at least once before the exam. It's really important and very beneficial. We have, of course, in our pool of questions on the website, we have many questions from old versions of the strategy. They are really important to go through, and they will be very helpful for all of you. But I suggest strongly you have to share and work through the updated strategy website for more questions. Past RCOG questions are really important. Now, at this point, I would like to say a very important advice. If you look around, you will find many groups for MRCOG preparations. Many Telegram groups, many Facebook groups, many WhatsApp groups. They are all posting questions and all doing discussions every time and everywhere. And I know the mentality of the MRCOG candidates. He or she wants to cover everything. So he will join this group and this group and this group and this group, and he will try to answer here and there. This is really very confusing. It's very dangerous, okay? Listen to me, it's very dangerous. It's exactly like trying to study all books in the market, trying to study from textbooks, trying to read everything. It's really very dangerous, because at the end, before the exam, you will find yourself lost. I cannot cover and revise everything. And without proper revision, you will miss a lot of basic information. So you have to be focused, and you should to be only smart to follow maximum 2 groups, maximum, okay? Otherwise, you will be lost, okay?
I would like to add one important point here of following a lot of groups. What happens is a lot of people who are giving out information in these groups might not be giving out right information. It might not be authentic a lot of times. And if you happen to remember that wrong information and mark the question according to that, you would be losing very precious marks. So it's best to stick to 1 or 2 groups which you trust and your guidelines, and not get confused. It is so overwhelming to see the amount of discussion that is happening, and then you feel like, oh, I don't know anything, and it is just a spiral of negative thoughts. So just stick to 2 groups which you think are beneficial, and that's it.
Exactly, Pradnya. And I saw Samah, she said something on the chat room, how to read and summarize the guidelines. Everything seems to be important. Now, this is our mission, is to simplify and giving you, everything is important, but there is something more important. And this is our mission. Now, I advise strongly all of you to follow the live sessions, because this will be the key to understand what is important, what is very important, and what is not important, okay? This is number 1. Number 2, I suggest that every one of you can build up, starting from now, building up your own notes. How can you do that? I will tell you the trick. You will write by your hands everything in the live sessions. After that, you will find, for example, a guideline, a huge guideline like postpartum hemorrhage or placenta previa, abnormally located placenta and morbidly adherent placenta. It will be finished actually in one, maximum 2 papers, because you catch the most important points from the live session. When you are going for the revision, no need to go to revise the guideline itself. You will just revise the 2 papers, and these 2 papers by your own. Okay, it will be extremely easy to revise the whole curriculum, which will be almost in 100 pages. This is more than enough. Okay, this is how can you technically take the maximum benefits from any live session, rather than just putting the AirPods in your ears and listening to somebody talking. Okay, I just would like to say something. You know, let me ask you, Samah, a question, or Daisy, or anybody in this group. If you listen to a lecture, after a time, how much percent of knowledge you will be able to recall or remember after listening to a very good lecture? How much percent you will be able to recall? 5%. It's not very less. It's extremely less. Only 5%. Okay, that's great. So what? No, not a 50%. 5 to 10% maximally. Okay. Now, 30% if you try to write it by yourself. Oh, that's great. So we reached 30%. Now, if you answered questions and visualize some videos related to the topic, now the percent is almost 50 to 70%. With discussions, exactly, Adam, Yassine, exactly. My son is called Yassine. Okay. Now, if you tried to explain the lecture to others and keep doing this, 90%, exactly, 90% of the knowledge will be in your mind. This is the basic teaching principle. Imagine that. So when I tell you, please listen and write all your own notes and try to do some discussions and active discussions, okay, with people in the group. And if you have some friends in the hospital or in your, social space, you can try to explain some topic for them. You are jumping from 5% retained knowledge to 90%. Imagine that. So 100% you will improve your skills if you're trying to follow what I said. It's not a magic. It's not like this. It's just a smart working. Okay? So this is what I would like to say. The smart working is not just to attend the sessions. It's not just to put yourself in different groups and all of you are sharing wrong information. Yeah, this is exactly what happened. Okay, it's not to pay here and there and strategy and this course and another course and third course. I'm doing the best way to cover everything. It's not like this. Try to be dedicated to one course. Try to be dedicated to a plan of work rather than spending too much time, effort, money in wrong directions. Again, Samah is confused.
Samah has a question. Okay. So I would like to answer to Samah. Samah,
sure.
I was in your exact situation. I was absolutely confused about what to prepare, how to prepare, and what I didn't even know what to talk articles. And this was exactly 2 years back when I had joined MedExam Expert as a student. And all I did was I blindly followed whatever happened in the course, but I was absolutely sincere in the sense, if a mini schedule was given, that is what we are going to do. If a mini schedule is given, I would read the entire guidelines, I would make my own notes, and then be completely prepared for the live session that is going to happen. I would take very active part in all the discussions that were happening. And I studied just for 4 months. I started from zero, as in absolutely no knowledge of part 2 MRCOG whatsoever, and I cleared in January. So I'm sure you will also clear. Just be persistent, just put in all your effort, attend all the live sessions. When you are there, attend it live. Don't listen to recordings, because the seriousness goes down. Be there for the live sessions, get involved in discussion, be sincere with your preparation, solve question books. I think these are few things that I would like to tell you from my own personal experience of how I studied for the exam. And I'm pretty sure that it wouldn't be a very difficult exam for you to crack, dear. Really very hopeful about it.
Yes, exactly, Pradnya. And I think, my friends, I can imagine how much all of you are stressed and afraid from the exam. Now, stress is normal with human beings, because you're going to do a very important exam and a very important step in your life. But fear is never a good thing, okay? What we need to do is, as Pradnya said, what we need to do just to follow the instructions. This is very important. And we did this course in the last 7 years for maybe nearly more than 70 times, okay? And we helped a lot of people successfully, because I think we had the experience to manipulate candidates. Even if you are starting from scratch, it doesn't matter. Sometimes, Samah, sometimes people who are naive or primitive, or this is not a bad thing. They are more successful than experienced people.
Yes.
Now,
yes,
now
I totally agree.
yes, look at this. If we have a candidate who is 50 years old with a lot of experience in the field, I can say about 90% he will never pass. He will never pass the exam, okay? Because he's already experienced by maybe wrong information. But for people who are still young, still not that experienced, and still aiming for the knowledge, their success rates are really higher comparatively to other people. So don't make this point so much a stressful point for you. Dr. Zaib is here finally. We are trying to
Yes, sir.
prolong the time.
Assalamualaikum.
Yeah, we are trying to prolong the time waiting for you, because it's impossible to be done without you.
So sorry, sir. So sorry. And so sorry for
No,
making you all
so
wait. I was busy in workshop candidates. So I just finished that session and just entered into this session.
that's
So,
great. So the mic is
yeah.
yours.
No, sir. No, please continue. Continue.
We are
Yes.
just trying to reassure the candidates regarding the time factor. The
Exactly.
information will be provided, and don't put too much burdens on your shoulders, okay? Just take it easy. It's a very simple exam, despite it seems to be difficult, and maybe the most difficult step in MRCOG. But if you can understand the aim of the exam and what are the points the college
Sir,
looking
I
for.
want to add one thing over here. It looks difficult because we feel, and this is the fact that the curriculum is kind of the so huge, and curriculum is like never ending. So whenever we look at the curriculum, we always think that okay, come on, I cannot finish this, in the given time frame or what. So I think we have to look positive. We have to stay positive at all times. That okay, I mean, we all have been through. We all have had the similar struggle and similar I can say the difficulty in completing this syllabus. But yes, if we can do it, I mean, everyone can do it, isn't it? So don't look at the syllabus. Yes.
Zaid,
Yes, sir.
one of the most common pitfalls is people are looking for perfection. It means
Exactly.
I need to prepare myself 100% for this exam. Let me say that you will never, ever being able to cover 100%. This, if you start studying 2 years before the date of the exam, you will never be able to do that. Okay, let's be
Exactly.
frank. So even the person who awarded the prize medal of the exam, he was not 100% prepared, because it's really impossible. So what we are aiming for is passing in the exam. So to pass the exam, I need to be following certain important rules. These rules will be provided to all of you by Dr. Zaib, Dr. Pradnya, and me.
Yes.
We tried this many times before, and it's really helpful and successful.
And
So
sir,
trust
we
that.
have just finished our revision workshop for September candidates, and we have had a very good response over there. And you won't believe, I keep on revising your lines at times that, you know, this Dr. Hassan has taught us, this we have learned from Dr. Hassan. Because of course, you know, we remember that, you know, how you, I mean, make things easy for all of us. So of course it stays in our mind at all times. So likewise, you know, we are going to continue the legacy. So of course we are going to give the same knowledge to our all candidates. So yes, things are, you know, the easy and things are possible. So guys, don't be upset about it. Okay, don't be upset about the curriculum and all. I mean, it's all doable. It's all doable. All you need is courage. All you need is what you can say, the persistence and perseverance and daily study. Okay, don't think that, you know, I have to pile up this whole schedule for one day. Nobody can finish it. Okay, nobody can finish. Even we, all of us, you know, me, Dr. Pradnya, Dr. Hassan, even when we have to go for any session, we do study ourselves as well before every class, because we have to refresh our knowledge, isn't it? So yes, it needs a lot of, you know, the struggle. It needs a lot of persistence and perseverance to continue the studies and all. Okay, so don't think that you can cover it in like 1 month, 2 months, 3 months. So at least, I mean, fairly 4 to 5 months are more than enough to prepare for this exam. Okay.
So yes, this is we will finish in a very short time. Manage to do one guideline in a day and try solving questions if possible. This is a very important thing. How much hours I need to study per day? This question is impossible to be answered, because it varies between another one to another one. Okay, I don't know your social capabilities, your responsibilities, your work, your family, your home, everything. And even you have to spend some time in refreshment as well.
Exactly.
So, exactly, it's not all about working. So how can I do that? It depends on you. You can decide how much hours I need to cover, how much hours I need to cover certain topic, and to be satisfied regarding this topic. So it could be 2 hours, could be 1 hour, it could be 10 hours. It depends on, okay? So this is your mission actually. Now, general advice, Dr. Zaib, if you would like to take this part, it would be great.
Yes, sure. Yes, sure, sir. Sure. Thank you so much. So I hope, you know, the candidates have learned the basic aspect of this exam, that how we are going to do. So, you know, the general advice, like, I mean, for every exam, there should be that you have to have a good grip on the subject. Okay. On the subject means that you have to have the good knowledge about the module, what you are doing is. So, of course, you know, it cannot be possible without following a good schedule. Okay. So you have to follow a good schedule. You are unable to hear my exam? Oh no, am I audible? Yeah.
Yes, you're audible. We can hear you
Okay,
well.
thank you, Pradnya. Thank you.
Yes, ma'am.
Okay, fine. So, like, I mean, we have to follow the good schedule, right? So, I'm sure you all know that we are, you know, conducting free groups activities as well on Facebook, WhatsApp, Telegram, and in dedicated course, you know, as well. We do run a separate schedule. So me, Dr. Hassan, Dr. Pradnya, we three are responsible for almost all part 2 and part 3, you know, the curriculum here and there. You know, we do try to manage the free activities, plus we do try to manage of course, the course activities as well. So we do try to make, you know, the good schedule. Trust me. the good schedule is a key to success, what I believe is, because I still remember when I was preparing for my exam, I was also lost like any other candidate there is. So once the schedule was posted on Facebook, so we used to follow that schedule, that for example, today we have to cover one guideline, tomorrow we have to cover other guideline. So what you need to do is, like I said earlier, that you have to be persistent, you have to be focused, okay, and you have to be following that schedule only, okay. Plus post as many questions as you can. It means that you are going to revise on your questions as well, isn't it? For example, if you have studied your one guideline in a day and you want to revise it, so questions can be a good the source for the revision as well. You will get to know about the plenty of minds, plenty of people who are the answering on under the your question. So what you can do is that if you are trying to post any question on Facebook group, on Telegram or WhatsApp, so what you can do is that once you have posted the question, okay, turn off the notification and come back after a few hours and see the what your other fellow colleagues have the answer. So when you are going to post the key, so at the same time you can discuss your question as well, that okay, for example, if I have given the answer A but somebody has given the answer B, so you can ask her, you can discuss that how have you come across with the key B while I think that the key is A. Okay, so discussion plays a vital role in your the memory in building your concepts as well. Okay, then of course once you are going to be thorough with your whole syllabus once properly, so what you can do is that you can revise, and revision is a good key, trust me, okay, until and unless you have covered each and everything but you haven't revised that. So what will happen in the end is that the things are going to be upside down, things are not going to be the same until you will go to the exam hall. Okay, so try to finish your one the whole syllabus in like 3.5 months time, and in the the rest of the days or months, all you need to do is you have to revise. Okay, so revision is a very good key. So you can post on the Facebook or Telegram, you can discuss, and if you have your own study buddy, you can discuss with that study buddy as well. But what I believe is that group study is always good. Okay, group study is always good, and from that group you can get your own study buddy as well. So of course you can do it, isn't it? Is it clear, everyone? Any question? Clear, everyone? Still not working? I think Rubab, you have your some problem at your end. Hi Daisy, hi Rajni, Zoya, Deepak. Very good, very good. Okay, so that's why we are trying to help so many candidates. The across the all social medias. Yes, hello, hello, yes, yes. Is there any question?
Yes, ma'am.
Mm-hmm. Yes, please.
Yes, I'm Dr. Samah.
Hi,
I,
hi. Mm-hmm.
Hi, hello.
Hi.
I want to ask because I'm still a little bit confused.
Uh-huh.
Because what I understand that we have to read guidelines and to make our own notes, and we have to solve questions regarding that one.
Of course.
It's like
Yes.
this.
Yes,
Okay.
yes, absolutely.
Because if you go through the book, questions will be scattered everywhere. Sometimes you cannot get the same questions. I feel still some confusion there. And another thing, for now, we supposed to start the first live session about
urogynecology. Yes.
And we have now the mini schedule. We have to finish those topics before going to the live session.
Yes,
and we have to make our own notes regarding this one also. Isn't
it's not mandatory, sweetheart Sama. It's not mandatory that you have to make your own notes, but it is a good idea. Okay, you won't believe.
Because honestly, we'll be honest, ma'am. One guideline is taking me like one day, and if it's 70 or 50 plus pages, sometimes it took 3 days. I feel like I'm losing too much time and no much achievement from that.
No. So this is your first reading. Am I not? Am I correct? This is your first reading, right?
Yes.
Okay. So first reading is always like this. Okay, don't worry. So the idea giving mini schedule is that at least you will have the good idea about the one module. And once Dr. Hassan will take your session, so he will clear out all your confusion in that the session. So while you will go back again, okay, while you will open your own, the notes, if you have made any, so, things are going to be very clear. Trust me, Dr. Hassan is master at urogynecology, and you will feel so good after having, the urogynecology session.
Yes,
Okay?
sure. I
So
thank you all, ma'am.
don't worry about it. Don't worry about it. And for incontinence guideline, yes, I agree. Incontinence and prolapse guideline is pretty lengthy. So that's why we have given 2 days for this. Okay. You can cover one guideline today and the prolapse part tomorrow. Okay. So even if you cannot finish like this, so, our one of the moderator could, the moderator, she will start discussion on your study room as well. Okay. So if you remember me posting yesterday night that, I have posted that we will start, all the daily discussion part as well. So I'm sure you will have, the lot of, the revision. So Sama, don't worry about it. Okay. Don't worry about it. So always remember, sweetheart. Okay. Your question part. So
Yes.
question part, of course, that is pretty, the challenging in terms of, because, we have got, the plenty of books. Okay. Number one. Secondly, none of the books are module wise except, the one or two. What you have to do is, that's why group study matters. That's why group study matters. For example, you guys are like, 40 today. So what we will do is that we can divide books, like one book you can, pick one book, I will pick one book, the other candidate will pick. So what we will do is that, okay, today's topic is incontinence. So, okay, come on, post questions from incontinence from this book only. Okay, you, for example, for example, Shanza is there. You are there. Okay, Maha is there. Rubab is there. Okay, Zoya is there. So what you can do is, Zoya can take one book. You can take one book. The other candidate can take another book. So this is how you can post from all these books. So by the end of the day, what will happen is that, you will be at peace that, okay, you have covered, or at least, 10 to 15 to 20 questions for one particular topic. And sometimes you won't even get a single question from, that topic, because we have revision books only. We don't have, the complete question from every topic there is. So all you need is, you have to have a good concept of one topic. And of course, question gives you, the idea that this is how a question comes in exam. Question is just practice. Okay. And doing question books is not even mandatory. Until unless you have good clear idea, then only you can solve questions. Okay.
Okay.
So don't worry, start is always difficult. And once you will be in the flow, I'm sure you will enjoy. Okay, you will
And
enjoy study.
Another thing, when reading nice guidelines, especially, there is many links inside the topic itself.
Don't go. Don't
go
follow.
to topic. So
Don't
you
follow
understand.
those.
I didn't
Don't
know
follow
this
those links.
or
Don't
no.
follow those links. Don't follow those links. You just have to cover, the important points. And incontinence is very small guideline, and Dr. Hassan will make it so palatable for all of you. Trust me, you will love it. You will love it after that. Okay.
So much.
So don't worry about it. Don't worry about it.
Thank you.
Okay. Yeah, summaries are enough as well. But sweetheart, Daisy, what I believe is that until unless you have touched your guideline yourself, you will not have good idea. Okay. But otherwise, trust me, summaries are enough. Everything is enough. But in the end, this is your exam. In the end, you have to be prepared for it. Maybe, as a human being, I have made some kind of error. Maybe I did not, pick that point. Okay. You got my point, Daisy. Okay. So this is how, we go about it. And rest, for the urogynecology, I assure you that, things are going to be very smooth after session. Okay, don't worry
Yes,
about it.
you put a lot of responsibility on my shoulders.
No, sir, you won't believe. Trust me, I still have my notes, what you have taught us in our part 2. Okay, so I can, vouch on that. Nobody can teach urogynecology, best than you. Okay?
Yes, thank you so much,
Yeah.
and I hope
I
people
agree.
will
Yes.
yes, thank you, Pradnya, thank you, Zaib. I think I will do my best in this
Yes, sir.
chapter and in this module to make it very easy to all of you, inshallah, and you will be able to cover all questions
Yes, sir.
yourself just after the session, inshallah.
Sir,
Yes.
not
Now,
just
this
urogynecology.
is
Sir,
the-
even your contraception, whatever you taught, I never went through FSR.
Yes. Sir,
Just
you
what
won't
you
believe,
taught,
me and
I could
Pradnya, we
solve
were
all
discussing it
questions.
other day. We were discussing
All
it other
questions.
day. And, she told me that, I don't have any my notes because I just covered from Dr. Hassan lecture. So I said, yes,
makes
same
sense.
for me. Okay.
I'm really honored and speechless for these wonderful expressions. Thank you so much, and I hope the candidates with us will be happy as well in your
Inshallah, they
sessions,
will be.
Pradnya.
They will be.
I believe in your sessions, Zaib, and my sessions as well. This is the course, by the way. This is the course, what the course will provide all of you. So, Pradnya, can you yes, take this part of the discussion? It will be great if you did.
Yes, of course. So we have shared we will share a schedule with you, which will be telling you when the live sessions are going to happen. Before each live session, we will be sharing with you a mini schedule, which will tell you what topics are to be read and from where they are going to be read. If you're having any difficulties finding the topics or the PDF files, you could let us know and then we'll share them on the group as well. So before the live session, it would be wise to have gone through the topics at least once, so you're not lost during the session. But it's like Dr. Zaib said, it's not mandatory, but it's a good idea, to be oriented to what's happening. In the live session, we will be covering all the important topics, all the important points, especially from exam point of view. We will be covering things from question books and strategy and all of that. Rest, along with that, we have the WhatsApp group, which is going to be there active 24/7. You can post your questions, you can post your queries there. Whatever doubts you have, once you post it, please do tag us so we know that we are supposed to go read it and answer, because there are a lot of tags that are there throughout the day. Along with that, there is going to be your website, which you have, on which the recordings of these sessions are going to be available. So you can revise them. You can revise on 2x, 3x, whatever makes you, whatever helps you cover the session faster. And or you could just jump to things that are difficult for you to understand. That is the best way to revise, I believe. The sessions, the live sessions, are the most important core thing of the entire course. Along with that, on your portal, you will also find summaries, written summaries. You will also find audio and video summaries as well, which are there to help you, but they should not replace your original guidelines as such. Okay, you should be going through your guidelines only when there is no time, or when you're short of time, or in emergency situations only you should be using them. Or maybe once you've gone through the summaries and once you've gone through your sessions and everything and you want to revise, maybe then you can go through them. Okay, but other than that, those should work as an adjunct to your preparation. And well, anything else, we are always there on Telegram, on Facebook. You can always reach to us, and we will be able to guide you further. Any doubts that you have, or you can get in touch with anybody from the team, and they'll be able to guide you as well. They've shared their contact link on the chat box here.
Exactly. Okay, so somebody has asked that how to make summary. So let me just show you a small glimpse from my own notes that how to make summary. So can I share my screen?
Yes, sure.
Yes, sir.
Yes,
Please.
Dr. Zaib.
Okay, thank you.
Just give me yes, of course, Dr. Zaib, you are ready. Yes.
Yes. Okay, so this is just the small glimpse. I think Shahzadi has asked, Daisy has asked, and Sama, that how to make notes. Okay, so somehow if, for example, this is a shoulder dystocia guideline and you are studying, so these are my this is my handwriting, so I hope it is readable. But the idea to give is that incidence, for example, this is important, recurrence is important, the important percentage from this guideline, that what is the PPH, the occurrence, what is 3rd degree, 4th degree perennial tears, brachial plexus injury, what is the risk factor for the shoulder dystocia. You can write it out like this. Okay, what is brachial plexus injury, the important points, what are the causes of brachial plexus injury. So the conventional risk factor predicts only 16% of shoulder dystocia. This is exam question, this is exam question, BPI is exam question. Okay, BPH is exam question. Then there comes the other question as well, that shoulder dystocia with less than 4 kilogram babies is 48%. Okay, and in exam it comes as 50%. So how you will deliver a baby with shoulder dystocia? So elective lower segment cesarean section with diabetes, so gestational diabetes more than 5 kilogram, you will the deliver. So this is how you make, what is the success rate of all procedures in the shoulder dystocia. McRoberts maneuvers 90%, all 4 position 83%. Okay, suprapubic pressure you have to give for 30 seconds. So this is how I had made, made almost all important points from almost all guidelines. And the many candidates, from our courses, they do try to make like this as well. So this is the rough, the idea that this is how you can make your own notes. Okay. And on the other hand, on the contrary, it is not mandatory. Again, nothing is mandatory. If you think that you can study directly from guidelines, if you think that you need printouts, okay, take printouts. If you think that you can study online, study online. If you think that you can make your own notes and you can just study, so you can study. Okay. So everybody has a different, the kind of the teaching, or no the studying way. Okay. So everybody has very different way. So I mean, do it, I mean, as suits you. So don't make it as a hard and fast rule that, okay, if Dr. Zaib has told you something, if Dr. Hassan is saying you something, Dr. Pradnya is telling you something, so you have to follow that. Okay. So we do try to simplify things only. Okay. We
You
just
know,
try to give
yes,
you.
you know,
Yes, sir.
Zaib, I would like to show people something. Just a second.
Yes, sir.
Yes,
Please.
yes, of course. Just a second, please. Now, it's very important. Now, this is, for example, the summary of the whole curriculum. Okay, it's available on the website. You can open it, and you can see that most of topics are very easy and
Beautiful.
systematically, presented like this, and it's really helpful. But this will never replace your own notes by yourself.
Yes.
It will never replace. You can find whatever you want here. They are really summarized and very targeted, and they are available on the website. But what I would like to say is your own work is definitely the best important thing to revise from at the end before the exam. Exactly like Dr. Zaid mentioned, and he talked about this. Thank you so much.
Exactly. So is it clear now, Shahzadi, Sama, Daisy, that how to make notes?
Yes, ma'am. Yes, thank you.
Okay. Okay. So this is
Yes,
the
ma'am,
only
definitely.
way
Thank
by
you so
which
much.
you can extract your own important. For example, I remember incidents by heart. So maybe I will not write. Okay. Maybe something which somebody else doesn't know. So everybody has the different strength. Everybody has different weaknesses. So we can't rely on someone's notes. I mean, there are the points. There are the days where the many people ask me to share the notes. Okay. I do share my notes time to time, but sometimes maybe because my basics are very clear, my concepts are very clear, so I don't write each and everything in my notes, but I just write the important exam points. Sometimes maybe that is not sufficient for you. Maybe you need
Exactly.
little bit more in-depth study. Okay, like Dr. Hassan said, that it will never replace what you will study for yourself. Okay, because you are the best critic of your own the studies, your own preparation. Nobody can the judge it. We as a teacher, of course, sometimes we pick it, that okay, this candidate needs sometimes little bit more push, this candidate needs the little bit more calling in the session as well, that okay, tell me this. And this is what we do. This is what we do. If we feel that everybody is sleeping in session, so we give them wake up calls. Okay, we ask them, okay, hello, you please, you. So I'm sure we all do the same. Okay, so don't worry about it. Exactly. You are the best one to treat yourself in the best way, in the best possible way, I must say.
Yeah, exactly.
Yes.
So I think we covered the most important queries to our course and for all most people. And I would like to, yes, I would like to thank all people attending this session and our colleagues in this course, which will be started very soon and will be preparing for a January 2023 exam. Thank you so much, Dr. Zaib. I know you were very busy, actually. And you
Actually,
just finished a very hard session, by the way.
yes.
So, but you insisted to join, and this is really a very
Thank you
important
so
added
much, sir.
value
Thank you
to
so
this
much.
session. Dr. Pradnya, I would like to thank you so much
Thank you so much.
for your extraordinary work. And thanks again for our power in mid-exam expert. Our power
Exactly.
are the people joining us. Our power is the candidates who believed in mid-exam expert and in in ourselves. So thank you so much. And finally, I would like to thank the back-end team, people who used to manage everything in a very rapid, professional, effective way. Thank you
Exactly.
so much, my dear friends. Thank you.
Thank you so much, guys. Okay, so links are there if anybody is interested to join the course. So everybody is they encouraged to join the course as well, because we provide the kind of the good collective, the kind of material and study as well. Okay.
Thank you and have a nice day.
Thank you so much. Thank you so much, sir. Thank you so
Thank you
much,
so
Dr.
much.
Zaib. Thank you so
Bye-bye.
much, everyone, for joining in. Bye bye.